My name is Lindsay Harville, and today I'm going to discuss proper intramuscular injection. This lecture will include correct intramuscular injection technique as well as proper injection sites. Although your handout that I have provided discusses intradermal and subcutaneous injections, today we're only going to be discussing intramuscular injections. When you're giving an intramuscular injection, the choice of site should take into consideration the patient's general physical status and age, as well as the amount of drug that is being given. You need to also look at the site that you're thinking of injecting for signs and symptoms of inflammation, swelling, and infection. Skin lesions should be avoided. 2 to 4 hours after the injection, check the injection sites to check for any adverse reactions. If you're giving intramuscular injections frequently, documentations of sites should be performed to decrease patient discomfort. If the patient has reduced muscle mass, bunching up the muscle before injecting is a good technique. There are 5 sites that are appropriate for intramuscular injections, and these are shown on your handout. These include the deltoid muscle, the dorsogluteal site, the ventrogluteal site, vastus lateralis, and the rectus femoris. The deltoid muscle is good for vaccines such as hepatitis B and the tetanus shot. The dorsogluteal site, using the gluteus maximus muscle, is very controversial due to the possibility of damaging the sciatic nerve or the superior gluteal artery if the injection is not given properly. The ventrogluteal site is a safer option in which you can inject into the gluteus medius muscle. This site is actually the most recommended because major nerves and blood vessels can be avoided. The adipose tissue of this site is more consistently thick. The vastus lateralis is on the outer side of the femur and is safe for children up to 7 months old. If you have a patient that needs to self-administer, the rectus femoris is more easily accessed and is a good choice. Figure 5A in your handout shows the deltoid muscle. You want to inject into the densest part of the muscle, and you want to find this by locating the acromial process and the area on the lateral arm in line with the axilla. The injection should take place around 2.5 centimeters below the acromial process at a 90-degree angle. You want to ask the patients to put their hand on their hip to relax the muscle to make the injection easier. Figure 5B in your handout shows an imaginary horizontal line across from the top of the buttocks to the greater trochanter of the femur. You want to draw an imaginary line vertically midway along the first line, and the location is actually the upper outer quadrant of the upper outer quadrant. This muscle is called the gluteus maximus. Figure 5C in your handout shows the ventrogluteal site. You want to put the palm of your hand on the greater trochanter of the patient's left hip. Then you extend your index finger to touch the anterior superior iliac crest. The needle should be injected into the gluteus medius muscle in the middle of the V, again at a 90-degree angle. Figure 5D shows the location of the vastus lateralis and the rectus femoris. If you're injecting into an adult, the vastus lateralis can be found by the greater trochanter and 1 hand's breadth up from the knee. The rectus femoris is in the middle third of the anterior thigh. Again, in children or geriatric patients, the muscle may need to be bunched up to get enough depth to inject. Although we've already discussed that an intramuscular injection should be administered at a 90-degree angle, it was not discussed why. The reason that an intramuscular injection should be given at a 90-degree angle is to decrease the pain associated with the injection. To ensure that this technique is performed properly, you want to prep the area of injection by placing the heel of your palm resting on the thumb of the forefinger. Figure 6 shows the correct technique at a 90-degree angle. I'm sure most of you have heard about the Z-track method. This is now recommended for intramuscular injections. Studies have shown that this technique reduces pain and leakage at the site of injection. When using the Z-track method, the skin is actually pulled down with one finger, just like that. Since the skin is moved a couple of centimeters, you need to remember that the muscle that you are injecting in, not forgetting your site of injection. Once you pull the skin downward, you want to leave the needle injected for 10 seconds to allow the medication to absorb into the muscle. When you remove the needle, the skin that was retracted is released. Tissues then close over the tissues where the injection was performed, allowing no leakage of medication to occur. You want to instruct your patient to exercise the limb afterwards to help increase absorption. Aspiration should always be performed when administering an intramuscular injection. If the needle is accidentally injected into a blood vessel, an embolus could occur, causing severe or fatal results. Once insertion has been performed into the muscle, aspiration should be done for several seconds to allow blood, if any, to appear in the syringe. If blood does happen to become aspirated into the syringe, you always want to remove the syringe and throw it away in a sharps container, and then you'll start the procedure over with a new syringe. Once you have injected and aspirated, if no blood appears, then you will inject 1 milliliter of medication over a 10-second period. Today we'll be injecting 1 cc of vitamin B12 into the deltoid muscle. So this should only take about 10 seconds to inject the medication into the muscle. Once the medication has been injected over a 10-second period, another 10 seconds should be given to withdraw the needle from the muscle. This again allows the medication to diffuse properly. If there is any leakage from the site, you just want to use a gauze swab. Do not massage the site, as this could cause leakage from the entry site. Before injection is performed, the skin should be cleansed with an alcohol pad for 30 seconds and then allowed to air dry for an additional 30 seconds. When you're discussing the needle size, the needle should be long enough to actually inject into the muscle, while a quarter of the needle remains externally. Usually a 21 or 23 gauge needle is used. Of course, the larger the patient, if they're going to have more fat, so the larger the syringe. When deciding on the size of the syringe, this depends on the amount of drug that will be injected. If injections are less than 1 milliliter, a low-dose syringe should be used. But if you're injecting over 5 milliliters intramuscularly, then the dosage should then be divided between 2 sites. Patients are often scared of receiving injections because of the pain. And if you're performing the right technique, as I had previously explained, this will help decrease this incidence. Now, I would like to demonstrate the proper technique of an intramuscular injection into the deltoid muscle using a 23 gauge needle. Firstly, you wash your hands. Secondly, I'm going to apply my gloves. I will then cleanse the top of the vitamin B12 vial with my alcohol pad. I will then take my needle and inject the same amount of air, which is 1 cc, into the vial as the amount of medication that I'll be given. And then I'll turn the vial upside down and then pull the needle back until I get the same amount of medication. I will then take the site of injection, which we're just going to pretend this is the acromial process. And I'm going to cleanse it with a new alcohol pad over a 30-second period. And then you'll let it air dry for 30 seconds. Once you've found the acromial process, you're then going to place the needle around 2.5 centimeters below. I will then inject into the muscle over a 10-second period. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then I'm going to wait an additional 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This allows the medication to absorb. I'm then going to remove my needle and place in a sharps container. Now that I have showed you the correct technique, I would like to see a return demonstration from you.